Welcome to Substance Free 02043, brought to you by Hingham Cares. I'm Kristen Root, and I am President and Program Director of Hingham Cares. Our mission is to reduce substance use among youth in Hingham, and to that end, we offer programming and education to the community. Our guest today is Senator Patrick O'Connor. Welcome, Senator O'Connor.
Thanks, Kristen. Thanks for having me, and thanks for all the work that you're doing with Hingham Cares and this program. It's great.
Thank you so much. So you've been representing the Plymouth and Norfolk District in Massachusetts for a few years now, since 2016. And Hingham and 8 other towns fall within that district, correct? Or 7 other towns,
7 other towns, yep.
Well, it's a pleasure to have you with us. Could you start by telling us a little bit about yourself, where you grew up, what you studied in school, that sort of thing?
Sure. So I grew up in Weymouth. I am the son of a nurse, a 40-plus year neonatal intensive care nurse in Boston. My mom, Teresa. My dad, Michael, is a plumber. He's still working currently at 69 years old, still going strong. He's at the McCormick Courthouse. So I grew up in a blue-collar household, both of them union members, and it really instilled in me a lot of hard work at a young age, seeing both of my parents work. My mother worked the night shift, and so, you know, as I was going to bed, she was going to work, and she'd always be there at, 2 o'clock, 3 o'clock to pick me up from school, and so I saw her and my dad really grind at a very young age, and it really gave me, in my opinion, the work ethic that I have today to be able to go out there and work, 60, 70 hours a week on behalf of the constituents of the 8 towns I represent, and I love it. I love this job. I really do. So I went to Weymouth High, graduated there. That was kind of where I first got my political bug. In 1999, they changed the form of government in town from a town meeting select board type of style of government, similar to what Hingham has, and in Weymouth it changed to a city council and mayor. And everyone literally ran for office, so there was probably about 40 different candidates for all these different positions. The town was a political hotbed at that point in time, and I was able to get involved in a couple of campaigns. Literally people who my parents knew, they were running, friends of mine, their parents were running, so it was literally everybody's running. And at that point, former Senator Hedlund, now Mayor Hedlund, ran for mayor unsuccessfully against Dave Madden, so I was involved in some of those campaigns and some of the city council campaigns, and I just knew at that point in time that government and politics was something that I wanted to, get into. And I didn't know if I wanted to be a candidate or if I wanted to work behind the scenes or if I wanted to work on campaigns or inside policy work and things like that. So I went to school over in London, England. I went to Kingston University. And studied both economics as well as political science. And it was there that I really was able to break out of my shell a lot more. I was involved in school government. I was the vice president of my graduating class in 2003. But once I got over to London, I was able to see how different societies operated, different cultures worked, to see a totally different political structure when it comes to less arguments and more conversations, and that people could agree to disagree and, literally, grab a cup of coffee or grab dinner that night with each other. And I didn't see that happening in the United States. And so it gave me a different perspective of how to actually, do politics and do government and how to collaborate. Absolutely. And so when I came back home, and actually this resonates really with one of the major reasons why I ran, and something that I think we'll get into in the next conversation. But in 2006, I was able to, in 2005, 2006, I was able to see a lot of the differences between what was happening over in London and what was happening here. And I saw my hometown really at that point in time take a major step backwards when it came to substance use. And at that point, it was the prescription drug epidemic that was happening then. It hadn't regressed to heroin and then further regressed to fentanyl. And I saw a lot of individuals that I knew, as well as family members, really get trapped in that vicious cycle. And it wasn't happening over in Europe. And I wondered why. I've done research, and now, in my opinion, I think that it's very clear that it was a mistake of the United States government to allow pharmaceutical companies to put out prescription-based medication that was essentially heroin in pill form.
So that was not approved in England.
No, they didn't.
They didn't have European countries.
The pain management structure over there was entirely different, and the amount of abuse that was happening here. I mean, prescription drugs were basically used at that point in time as a party drug, the same way that other drugs are being used now. And I knew that I wanted to do something about that. And at that stage, the town really wasn't doing much of anything. And so I decided to put my name up for election. I was 21 years old, just back from London. And I was able to knock on doors and get a message across. And it wasn't just substance use. It was that, the Fort Bridge was crumbling. The South Weymouth Naval Air Station was still a mess. There was just unresolved issues. And I thought that it needed a different perspective. And a lot of people discredit you just right out of the jump because you're 21 years old. But I was able to convince enough people and get elected at 21 and was able to serve in the city council for 12 years. And rose to the rank of city council president, which I was very proud of. It's actually one of my proudest political sort of inside of politics achievements because I was the only Republican on the city council. There was 8 Democrats, there was 2 unenrolled, and there was 1 Republican.
And you were probably one of the youngest also, right? If not the youngest.
Yeah, I was I was in my, at that point in time when I was 21, I was, one of the youngest people that definitely had served in my community, but throughout the entire state. Mm-hmm. And so was able to achieve city council president and then worked parallel towards that. My day job was working for Bob Headland up in the Massachusetts State Senate. Mm-hmm. And when he decided to run for mayor, I threw my name in the hat again, the ring, for the Senate and worked really, really hard. And in April of 2016, I had a primary. In May of 2016, I had a special general. In September of 2016, I had another primary. In November of 2016, I had the regular general to finally get a full term.
Is that a record?
I don't know.
It must be.
I hope nobody else has to deal with that because it was a crazy year. I mean, just crazy. But I wouldn't trade it for anything. I love this job. I love being able to go out and help people on a day-to-day basis. I have a great team, some of which are behind the scenes here with us today, that work really hard to make sure that people's needs are met. And that we have a common sense approach towards what government is, and that we stay away from the noise that far too often really, crowds up the structure and conversation of politics, and we try and get to the core, which is helping people, making our communities safer and stronger, and providing opportunity. And I think at its core, that's what government is, and what people should really start to focus back on, rather than trying to make a name for themselves or trying to make a lucrative living. This is a job about service, and I treat it as such. And so that's sort of the longer.
I think you just answered
version.
Questions 1 through 4.
But no, that's why we do this on a day-to-day basis, and substance use is at the core of a lot of what we deal with on a day-to-day basis.
Right. I think it's interesting that, at a young age, you discovered that there are ways to work collaboratively. When you served on town council, you discovered that there were ways to work collaboratively, even if you came from a totally different political vantage point. So currently you serve on the Joint Committee on Mental Health, Substance Use, and Recovery. Do you find that collaborative effort exists within that committee?
Absolutely. Last session, we were able to pass the Mental Health ABC Act, which is ABC is short for Addressing Barriers to Care. This is, in my opinion, going to be the moonshot type of legislation that a state needed to do to address mental health. And mental health and substance use are tied so incredibly closely together.
Yes.
That this bill will treat mental health and substance use the same way that general health is treated. And we're going to try and work on the successes that we've had in Massachusetts, as far as, in my opinion, being the best state in the entire nation when it comes to general health care. Mm-hmm. Our hospitals are the best in the world. By the time that we're done talking today, I'm sure that there'll be more than 10 people that have flown across the world to come to access care in just the time that we've been able to talk today.
Right.
And so...
Is that groundbreaking legislation nationwide?
It is. So one of the things that it does is it requires insurance to cover an annual mental health examination the same way that it would do a requirement of a physical. And so a mental health exam, if an individual wants to get it, is going to be treated the same way as a general physical.
Right.
And in addition to that, it's going to try and create an infrastructure the same way we've created a general healthcare infrastructure that deals specifically with mental health. This is by far the biggest issue that we came across during the COVID pandemic. The amount of children and adolescents in particular who are struggling with mental health issues has risen so dramatically.
Yes.
And we need to do something about this because, as we talked about the parallels, when people start to feel like there's no hope out there and that there's no access to care, then they start self-medicating, and that's where we, land in so many of these different substance use issues that, far too frequently impact negatively people that have mental health issues as the main driver of why they need help.
That's right. So it's interesting to think of issues in terms of legislation and how the legislative body can address those issues. What are some of the other notable pieces of legislation or bills that have come across your desk that address this issue, substance use, mental health?
Sure. So we have a bill before the Joint Committee called Kai's Bill, which is named after Kai Perry, who passed away of an overdose in Duxbury. And his mother came to us, and the reason why she wanted something to be done was he overdosed amongst family and friends, some cousins and some other people that were present there. And what happened was they got scared, and they didn't know what to do, and they didn't call 911. And so we have a bill.
Were they afraid of consequences?
They were afraid of consequences, and they did not know about the Good Samaritan law that exists in Massachusetts.
Right.
And so this bill would really require that when schools do the annual assembly that they do, or when organizations like yours go into the schools, that there's a requirement that the school let students know that there is a Good Samaritan law, and that if something does happen, obviously the main goal is to educate and make sure that no child has the struggles that are associated with substance use disorder. But if they do, and if they're in a circumstance where somebody overdoses, that they're not going to be held liable for any of this if they call 911,
Right.
and they make sure that individual gets help. Because we have Narcan, we know how to reverse the effects of opioid overdoses, and we should be doing everything we possibly can to make sure that those individuals have an opportunity to continue the battle that they have with this addiction. And
Sometimes it's just somebody, combining substances the wrong way, and it ends up being a lethal combination. So sometimes we find that, especially with young people, it's not necessarily a substance use problem. It's a situation where they're at a party and they drink too much. They combine with other substances. There's a family in Winchester that's put together a nonprofit. It's called If They Had Known, or a film, I should say. It's called If They Had Known, and it's about their son who combined Xanax and alcohol at a party. He put himself to bed. He thought he was doing the right thing. His friends all thought they were doing the right thing by encouraging him to go sleep it off, and he ended up dying during the night. So, there are lots of different angles to this issue, but that's tremendous. And for this family to take their pain and then turn it around and turn it into something that can be beneficial to others, I commend that family. That's tremendous.
well, they're amazing. Tamika, his mom's great, and in addition to that, just without getting into specifics, bills, we're really looking at the space as a whole as far as what we can do to continue to open up community-based supports. When it comes to substance use disorder, we're looking at making sure we have a workforce in place when it comes to individuals who are helping folks who are struggling with substance use disorder, as well as on the mental health side to make sure we have trained individuals who can provide assistance to folks, because right now one of the biggest issues that we're facing as a state is a labor crisis, where we're a great state, we're a very expensive state to live in, and a lot of our folks, when they graduate from college, aren't deciding that they can't afford to live in Massachusetts, and they're taking their talents that they've grown here elsewhere, and so we need to do more when it comes to that, to address these issues too. So it's kind of one of those things that it's all encompassing. It's not just an issue of, all right, we need 100 more nurses in the substance use space. It's no, how do you get those nurses? How do you make sure that they can afford to live in the state?
How do you retain them?
Yeah, how do you retain them? How do you make sure that they have housing stability as well, and they can live near where they work?
Right.
All of those issues are sort of the focus of what we're trying to do to rebuild our workforce and focus in especially on the needs of the most vulnerable in our communities.
So are you talking about returning to opening institutions, having a return to that? I know a lot of I'm trying to think of the word that I'm looking for. I don't want to say mental health institutions, but that's essentially what they were.
No, I don't believe in that structure. I think that what we need to do now is really grow a system very similar to what we have in the healthcare, the general healthcare space for mental health supports.
So you're not talking about housing individuals with mental health issues or substance use issues. You're talking about outpatient treatment?
No, I'm talking about specifically, if you have individuals who work in the substance use space, to make sure that they have the availability of housing.
Right.
So when it comes to an individual who is deciding to take on a job inside of the substance use space, say you're a nurse, you're not going to make as much money if you're doing that work than you are as if you went to a hospital in Boston. You're just not. You're not going to make the same hourly wage.
Right.
And so we need to make sure that those people have the same opportunities that they would if they were making more money someplace else. And now those same opportunities, in my opinion, come to making sure that they have a quality of life that's accustomed to that. Human services, in my opinion, across the board, from folks who deal with individuals with substance use disorder to folks who serve our disability community to folks who work in nursing homes, those human service workers, I think, are the most... They do work that nobody else would want to do for very little pay.
Right.
And they do God's work, in my opinion. And we're trying our best to continue to increase the wage every year to get them more and more money. But the fact remains that as we continue to increase those wages, the cost of living in the state continues to go up. And, inside the Joint Committee on Mental Health, Substance Use, and Recovery, we're cognizant of that we're losing a lot of people, a lot of good people who work in these fields that don't get paid a lot of money because they can't afford to live in the state.
Right.
And so our issue when we talk about housing and things of that nature is more towards the workforce that's going to assist the individuals who are struggling with substance use, who are struggling with mental health issues.
So you're not talking about reopening institutions that
No.
traditionally had addressed. Okay. So you're talking about retaining a workforce, enabling them to have the economic means to stay within our state to address this issue, but address it on an outpatient basis. You're not talking about reopening facilities.
No,
If I understood you correctly.
No.
Okay.
My whole structure on the housing component in its entirety.
Strictly
workforce.
Gotcha.
No, I mean, and I don't have the answers as far as how the long-term solutions are going to go to address this issue as it continues to increase in numbers. But no, I mean, deinstitutionalization happened in the 1980s. What's currently going on right? I don't think that worked. I don't think what's going on right now is working either. You see far too many people who are struggling literally on the streets.
Right.
We have 3-4 city blocks at Mass and Cass right now that
Homelessness is directly tied to substance use disorder, mental health issues, for
absolutely.
sure.
And then you have people who are probably at their most vulnerable that they've ever been in their entire life, and you have other people who are out there that are taking advantage of those populations too. So
Right.
we need to do more, just in general. I'm not saying outpatient or inpatient, and I'm especially not saying the mental health institutions.
Mm-hmm.
But I would say that what we have right now isn't working, and we need to do a lot more.
People can get a little bit frustrated with how long things take, how long it takes to address a particular issue or a particular crisis. I think a lot of people don't fully understand the progression of things as things move through the State House, as things move through our federal government. There's a lot of red tape. There's a lot of steps that need to go through. Could you explain, give us an overview of how the legislative process works so people can understand what happens with that track?
Sure. So every odd year, we are sworn into office in January. And from there, we have about a 2 or 3 week window to file bills. And so this year, there was 6,500 bills that were filed.
Wow.
Between the House and the Senate. And once they're filed, they're originally given a docket number. So that's sort of, the paperwork goes in, the clerk gets it, they stamp it with the docket number, and then from there, the clerks in both the House and the Senate go through every single one of the bills, read every single one of the bills, and then send them to committees. And so that's probably around the mid-February, early March time frame. And then once these committees get the bills, legislative leadership at that point in time have determined who the chair of the committee is going to be, who's on the committee, who's the ranking member as a Republican. I can't serve as a chair as we're in the minority, so I serve as a ranking member.
Okay.
And I'm on 19 committees, which is the most in the entire legislature because there's only 3 Republicans in the Senate of the 40-member body, and a senator has to be on every one of the committees, the joint committees. So it puts us, it puts us in a lot of different policy subjects that we can dive into and put the influence of the South Shore on, which I really appreciate.
Right.
So then the committees have up until basically a year from when they get it to hold what's called a public hearing. And anyone from the entire state can testify. They can submit written testimony, or they can virtually testify now, or they can go up into the State House and testify. And after that, the committee has basically up until April, May of the following year, the even year, let's say,
Okay.
to get something done. And so that's sort of the 14-month cycle from when a bill actually gets to a committee until when it gets a determination. And the committee can choose to say it should pass, and which is a favorable recommendation. They could say it should go to study, which means we're not going to say no, but we're not saying yes. Mm-hmm. And then it's unfavorable recommendation, which very seldomly happens because a lot of times they just get sent to study. And
I was just going to say most things get sent to committee, right?
Sent to study,
Or
yeah.
sent to study.
Yeah, so that's the basis of how it goes. A lot of there's some other structures that you can get things out quicker if there was more priority on certain things like budgets and other certain bills that may address a need that's a very very dire. Mm-hmm. But majority is it goes through that process, and it's a very slow process. I wish it was faster. I wish there was more that we do on a day-to-day basis when it comes to up on Beacon Hill. Mm-hmm. We're putting in a lot of work. We testified yesterday on a bill to reform the personal care attendant system. We worked with an individual who was a great self-advocate, Katie Kondo in Hull, who came to me. Actually, I went to her house 6 years ago, and she told me about how her needs were not being met by the state and how we needed to reform the PCA system. And so we testified on that. Yesterday, we have the second most amount of bills that were filed in the legislature that I've put forward, and a lot of this comes from people in the district who have an idea, and we sit down and we hash it out and we talk about it, and we put pen to paper and we try and get something done. Mm-hmm. And I've had a good amount of success in the 7 years I've been up in the legislature as far as passing bills. My main focus and core policy proposals have been individuals with disabilities and making sure that their quality of life and their protections are in place. Mm-hmm. And, my hope is that we can continue to move forward and pass some of the legislation we have this year to, get it across the finish line. But it's an uphill battle. Right now we're in September and we've passed, a few budgets. We passed the general budget. We passed some supplemental budgets. We got Chapter 90 money out, which is the money we give to communities for road and bridge repairs and things like that, sidewalks.
Right.
But realistically, the major policy pieces that we want to see get passed this year to continue to, provide more opportunity, to get a skilled workforce in place, to address the substance use issues, a lot of those policies are still in committee right now.
And is that because of budgetary constraints, or is that because of need for additional study, or
it's just the process. Some of the bills haven't had a public hearing yet. Mm-hmm. Others have, and we're seeing now the first bills kind of being discharged from committee favorably or to sent to study. We just took a poll today or 2 polls, one in labor and workforce development, and the other one in mental health and substance use. Public health.
So in terms of marijuana, the progression to where we are today in Massachusetts has been a slow one, starting with its decriminalization in 2008 when penalties for possession were changed. In 2014, towns were required by law to zone for medical marijuana. And then in 2016, the recreational use of marijuana was legalized in Massachusetts through a ballot question. However, each town at that point was allowed the option to put a moratorium in place on recreational use. A woman from Colorado that we have had on our podcast who lost her son to suicide as a result of a psychotic episode due to his addiction to high-potency marijuana says that for every $1 of revenue, there's a $3 cost to marijuana for things like emergency services and law enforcement. An addiction specialist that we've had on the show from South Shore Health says that they're seeing a significant uptick in marijuana-related illnesses. And a woman who runs a treatment program here in Massachusetts has told us that marijuana addiction makes up a majority of their cases currently. And that's definitely been, the trend. However, in spite of this, it seems like there's been a slow change in opinion in favor of allowing recreational marijuana. Are you noticing that towns are revisiting these moratoriums, looking to lift them? And do you know why that would be? Is it for the economic benefit?
Yeah, so when I was on the city council in Weymouth, was a city council president, we banned recreational marijuana in Weymouth, and I stand by that. I think that, some communities that I represent have, put in place dispensaries. Others still have bans in place. And, when we look at the economy right now of certain communities, there is definitely a struggle that's going on as we continue to build out our communities. That, in Hingham, for example, you had to, put in place an override this year in order to fund operational services.
Oh, you mean like a financial struggle?
Yeah. And so some communities look at this as a golden goose, as a huge money maker that, the community can go in and get the tax revenue, and they can use that tax revenue rather than having to go to their tax base and ask for an override. And I respect all the decisions that are made at the local level by local leaders. It's not easy. I did it for 12 years. I know that it's not easy. But my hope is that we can really get a grip on how specifically all of the recreational marijuana facilities and where they're located, and make sure that when you talk about the high potency marijuana, we have a bill to look at this, have the Cannabis Control Commission actually look at some of the high potency marijuana that's going around, and try and do as much as we possibly can to, we have restrictions in place as far as the recreational use, but in the medical use, there is higher potency marijuana that's available to patients. And so the whole space is complicated, and, communities make their decisions a lot of times based on, hey, there's a housing development going in. It's going to bring X amount of money in tax revenue. And you don't look at, the potential of, how many students are going to be there, and how much is that going to cost our tax base, and certain other elements of that. And I think the same thing happens with recreational marijuana facilities. You look at the bottom line and you see all that money coming in, but then you don't see the real cost of that, of how much is this is going to cost public health, how much is this going to impact the quality of life on our students and things of that nature. But look, it's here. I didn't vote for it. I didn't support it when it was a ballot question. It came that way. We are held completely to what the voters want when it comes to ballot questions.
Right.
So this came into law, and we're doing as much as we possibly can to, do more than just nibble around the edges, but actually look at how this policy is implemented, look at the Cannabis Control Commission and the work that they're doing, and make sure that we put in as many protections as we possibly can to especially the youth of the state, to make sure that they're not negatively impacted by what's happening with laws of legalization of marijuana.
Still on the same topic, members of law enforcement have consistently said that we weren't ready for legalized recreational marijuana. And the reason for that is because there's no way to test if someone is under the influence without drawing blood. And even then, the test results are not completely accurate. They can't tell how long it's been since somebody has used. Could you explain how search and seizure laws and how constitutional protections around drawing blood in Massachusetts play a role?
Yeah, I mean, when you talk about, specifically driving while impaired, there isn't a smoking gun like there is with a blood alcohol test when it comes to alcohol.
Right.
And so they've developed a structure called drug recognition experts, where police officers are trained inside of the departments to look for telltale circumstances of an individual being impaired by marijuana and then driving. And these have been very controversial when it comes to the acceptance inside of our judicial system, where some judges just automatically throw it out and say, it would
too subjective.
Yeah, basically it would be me saying that, John Doe was impaired and John Doe saying they weren't, and then the judge basically going to the police officer and saying, how are you qualified to do this? And there is training and there's other things that they, can recognize with this.
Right.
But without the actual evidence of, a test, it's just one person's word against another. Right. And although that person is law enforcement and credible and trained in the subject matter, the legality of it as you go through the judicial system is a very gray area. And it's used sometimes, other times it's not used. I have heard that there is some technology that they're trying to develop to give an actual, test associated with it. I always said that when the police, came in and talked about drug recognition experts and things of that nature, I said that the person's going to make a lot of money when they create a test to actually figure out what sort of level a person's impaired with, marijuana.
Absolutely.
And right now it's subjective. It's a gray area, and there's not a lot that we can do. And unfortunately, too many people, in my opinion, are doing this. I'm on the, highway sometimes, or driving around the streets of the South Shore, and you can smell it, coming out of a person's car. And it's a real risk and danger to have that out there, individuals who are impaired on our streets, the same way it is with drugs, the same way it is, with alcohol, the same way it is with an individual who's been up too long. There's just too many things that can go wrong when you're impaired in driving, and it's one of the most serious things you can do is get behind a wheel and put yourself and other people in danger.
Right.
By not being, completely clear of mind.
Right. So a couple of years ago, the Attorney General's office in Massachusetts settled with various entities like pharmaceutical companies and retail outlets to provide municipalities in Massachusetts with opioid recovery and remediation funds. Recently, you were asked to join a commission that was established in 2020 that was charged with the task of determining how the opioid settlement funds would be used. Could you explain how the process for distributing these funds and a little bit more about the role of the commission and its goals?
Sure. So we just really got started on this as far as where the state funds go. And what we've done is we've formed a commission where we're going to take the money that has been given to the state. Specific towns got their own money as well, and I believe that the towns are going through the process of securing those funds and then figuring out where they want to use them. I'm sure that some communities will fund their different substance use organizations with those, individuals within the town who work in the field, possibly programs within inside the police department and fire departments, things of that nature, education programs inside of the schools.
Right.
And our goal with the state money, predominantly from the Sackler family, who owned Purdue Pharma, which was OxyContin. We are going to form a group of individuals that are very familiar with the substance use space and what's worked and what hasn't worked in other states and program that's worked here. And we hope to form a program where we have a grant process where folks will submit their applications and the state will look at those applications and try and do as much as we possibly can to get as much money out into community-based supports that have worked both in the education, the prevention, the recovery, the substance use space of this entire opioid
treatment
pandemic that we have. It's a very serious issue that we are going to pay a lot of attention to. The Bureau of Substance Abuse Services, BSAS for short, has every single year I've been up there for the 7 years been funded at historical highs, and we continue to see the number of deaths in our state and our country also reach historical highs.
Right.
We need to do so much more when it comes to education. We're never going to, and I hate saying this, but it's the truth, we're never going to treat our way out of this, and we're never going to arrest our way out of this. It's all about education. It's all about getting to the next generation and making sure that they know how deadly the specific opioids that are out there on the market right now are, how to avoid them. If they have surgery or other circumstances where they need pain management, to use non-opioid based pain medication. Like, we need to do so much to make sure that this doesn't continue on. I've I've lost a family member to this. We've lost friends to this. This is something that impacts indiscriminately every single person across the board. And when you talk about last year losing in America over 100,000 people, that's just short of double what we lost in all the years of Vietnam. And it's happening every single year on our soil. And we need to do more to combat this. I've already said this to many people before, but if there was a circumstance where anything that we were exporting in our country, whether it be legal or illegal, and it landed in another country, and what we were exporting was killing 100,000 of their residents, I would hope that that country would hold us accountable for that. And my hope is that the United States of America starts holding accountable individuals and cartels and other folks
Bad actors
who are responsible for this coming into our country, because it's not predominantly being produced here, and it's being predominantly used here, and we're losing a generation of people every single year to this, and we need to do more to stop it. And my hope is that, as we continue to move on, I always said that if I was advising the president, the first thing that I would say is looking at those numbers and looking at 100,000 people dying every single year, 33 times what died on 9/11.
Right.
And seeing the cost and pain that this is taking on American people and our economy and everything. And our economy is obviously secondary, but it's a factor. To see all of that, I would say that if I was advising the president, the first thing that they should say when they step up at the State of the Union is that we're going to fix this. We're going to address it. I've never seen, and the state's doing as much as we possibly can, but it really takes the federal government to act on this as well.
Right.
I've just never seen such a blind eye turn to such a big issue before. And it's not being turned from my office, I can tell you that. We're working on this day in and day out with people who are in treatment and recovery, who are looking for help, with our law enforcement, our communities, trying to do as much as we can in the 8 communities that I represent to push back on this and to make sure that people have the supports and treatment they need to continue to battle this devastating illness that they have. And we need to do more to make sure that the accessibility of these drugs are a lot more scarce.
Those are excellent points. And, one of the things that is really the only thing that works is prevention. Educating people, making sure things don't get into the hands of our young people, making sure that addiction, proclivity doesn't get started at a young age. So prevention is really critical, and I appreciate you highlighting that in everything that you just said. So in your opinion, are there ways for the legislature to be preemptive in its work to battle the dangers of substances? You just mentioned that you work with law enforcement, the medical community, things like that. Are there ways that you can get ahead of the curve to make sure that certain things aren't getting into the hands of our young people, or that another opioid crisis can be averted?
I think that government in and of itself, at the state level, we have the prescription drug monitoring program, which I think is great to make sure that we know exactly what prescriptions individuals have to prevent abuse that way. We've done a lot when it comes to the substance use space policy-wise in the state. And when Governor Baker put in place his 2 pieces of legislation, they actually were a domino effect that traveled all across the state. I believe it was over 20 states picked up on almost the exact language that the governor did. I mean, he spent a lot of time making sure that we got this right. And after years of double-digit growth in deaths and overdoses, we actually saw in 2019 and in some of 2020 the first time that the numbers went down. But then, unfortunately, the pandemic hit and everything was erased.
Right.
And so when we talk about the preemptive components, I would say that if we could have a time machine and go back to the early 90s when the federal government approved these pain medications to go on the market, I think that would be the smoking gun situation. And so my hope is that the federal government doesn't allow this to happen again. I think that this was completely avoidable. It's one of America's biggest black eyes, and we need to do more when it comes to making sure we have regulatory authorities, specifically the FDA, that are not beholden to pharmaceutical companies, but actually beholden to the health and well-being of Americans.
So if you were to advise parents on how to keep their children safe around substances, what is one salient point? You mentioned this connection that you have to the issue of substance use, addiction, loss in, both family and friends. What is one piece of advice that you would give to parents of young people on how to keep their children safe around substances?
Be honest about it. It's not one of those things that I think in the the 80s and the 90s, when I was growing up, it was this is your brain on drugs, and they were I would say less realistic and more sort of
Gimmicky.
Gimmicky, yeah, that's a great word for it. And you need to be real. The drugs that are out there now are significant. There's gateways all across the board to all these different drugs, and I think that it eventually lands with fentanyl at some point in time. And that's obviously not to say for everybody, but for individuals who have severe substance use disorder, then they're going to climb. And I think that people just need to really have their kids be educated on this. It's no joke. It's everywhere. It's in all of the 8 communities I represent. And the negative impact that this has on people's lives, and not just their own, but everyone that's around them, and how this deteriorates families and spirals into things that people would never even think of doing. Those are the realities of what substance use disorder is, specifically opioids.
Right.
And people have to know that and say, this is what could potentially happen if you go down this route. It's not, the sort of like don't smoke pot, or, don't do, don't drink, or, one of those things. Those things are all, way too commercialized and in pop culture right now. This isn't enough. And people need to see the reality of what opioid addiction is. Being able to be up there for 7 years and talking with people who were in long-term recovery, and then seeing, a Facebook post, a couple weeks after seeing that individual relapsing and dying. This is a disease that grips you and does not let you go. And we need to do so much more in making sure that people realize the actual human toll. 100,000 people, to everyone at home, I would think about that number, 100,000 Americans dying annually from this. That's how deadly it is. And then you see situations like what's happening at Mass and Cass, and that's happening in almost every major city across the entire country, where you have people who are forgotten, but still matter to somebody.
Right.
And we need to understand that that's what this is, and do so much more to stop it and provide as much help as we possibly can to those who are in the real wrath of this addiction.
So I guess if I could summarize your comments, it would be for parents to get educated and have honest conversations with their kids.
Yeah, I mean it's all out there. It's before our eyes in most days. If you travel into Boston, or you see what's happening in different aspects of our communities, it's there.
Right.
Substance use disorder, mental illness, opioid addiction is there. It's in front of us, and we need to have real candid conversations about the toll that this is taking on individuals, and that scare tactic, for lack of a better term, but an educated scare tactic, I hope would work, because it's no joke. It's not one of those things, and not to discredit it, but I mean, marijuana is legal now. But, when we were kids, it was, all the evils of marijuana, and there's definitely significant challenges that people have when it comes to marijuana addiction and things like that. But the opioid conversation is so much different than everything else in that space, because of how deadly it is, and because of how addictive those drugs are.
Right.
and how quickly the regression is. Mm-hmm. And it's as I said, we have tens of thousands of grandparents raising grandkids right now. We have, just under 3,000 people dying in the state every year, 100,000 nationally, and so many others who are just completely lost.
Those are grim statistics.
They are,
for sure.
And that's the reality of just where we're at right now when it comes to the opioid crisis.
Right. What advice would you have for young people about how to make safe and healthy choices around substances?
Very similar to the conversation with the parents. My hope is that after that conversation with the parents happens, we have some amazing kids in this district. I go to schools all the time, and I see them, and I talk to them, and they're so smart and full of life. My hope is that age appropriate, you have the conversation with your child, and that's obviously a personal decision between the parent and the parents and their kid. And then from there, I would say to have community-based supports as well as public school-based supports that are educating, that are specifically focusing on prevention. But I don't think we should sugarcoat this. I think that we need to get real with people, and that's just because of how severe the situation is. Mm-hmm. And my hope is that kids, when age appropriate, 14, 15, when they're sort of coming of age, that they take a hard look at the realities of opioid use and substance use in general, see how it negatively impacts so many aspects of day-to-day life for individuals, and hopefully, see that there's so much that this world has to offer that substances are not the answer.
One of the things that we're most proud of at Hingham Cares is putting together a Hingham Cares Day at Hingham High School. And that was through collaboration with Rick Swanson, who's the principal over there. He's a huge supporter of ours. And we bring in great age-appropriate programming for grade-specific assemblies. So each grade has a presentation done on a particular substance, a particular topic. And it's been really, really well received, really tremendous. It's made a huge impact on these kids. So we're coming up on our 3rd annual Hingham Cares Day this coming spring.
Nice.
And it's something that we hope to continue. So to your point about starting them, getting them educated at a certain age and making sure that it's age-appropriate education as well.
Yeah, that's great. I love that you do that.
Thank you so much for joining us today, Senator O'Connor. It's been a real pleasure.
Oh, likewise. Thank you for having me. I really appreciate it.
Thank you for tuning in to Substance Free 02043. Our guest today was Senator O'Connor. We appreciate him joining us for this important conversation, and we hope that you will tune in again.